can think of a patient I had, and when I looked back in the chart, he had been hospitalized for similar severe infections multiple times in the past 6 months. It seemed to be this kind of continuing cycle for him, and wasn't really ever getting back to some sort of kind of a healthy state, was having these illnesses and going to rehab and coming back with them. And so when I sat down to talk with his daughter and ask about what his goals were and whether she thought that the treatments were in line with what he would want, or whether we should maybe think about trying to back off from aggressive medical treatments and make sure that he was comfortable, she immediately embraced that. Sometimes we just have people revolving through the medical system who the family is exhausted from it. The family doesn't think it's in necessarily their best interest, but nobody even really has the time to sit back and consider that and come to that conclusion. We are working to create a tool to help facilitate advanced care planning discussions early in the course of disease. One of the reasons that we hear that these discussions aren't happening frequently enough is that primary care providers may not feel like they have adequate training to really navigate some of the difficult discussions, or they feel like they don't have enough time. The whole first part of this grant will be focused on engaging patients with dementia and their caregivers to identify the range of kind of things that are important to be included in this discussion. If we look at, we are better implementing the individual patient desires. We are reducing caregiver burden, which is a huge, huge problem. There is a lot of literature for caregivers across the board, and especially for caregivers of dementia, of how significant the impact of the caregiver burden is. And then potentially the unnecessary strain on a health system that's doing things that aren't necessarily even in the patient's desires. I think those three on a whole kind of sum up the main things that we're trying to impact.